extra weight around your waist, your body may be particularly resistant to diabetes treatments. We all need to reduce saturated fats and high-fat foods in our diet. Some examples of foods to cut down are cheese, full-fat milk, cream, red meat, chicken fat, schmaltz, cakes, biscuits, butter, margarine, oil, mayonnaise, and pre-packed foods. To reduce your fat intake, take the skin off chicken, trim all fat off meat. Grill, bake, or steam instead of frying. Choose skimmed or semi-skimmed dairy and soya products and cheese. Reduce high-fat snacks such as crisps, nuts, cakes, and biscuits. Use mono or polyunsaturated oils and spreads based on rapeseed, sunflower, or olive oil in small amounts instead of butter and solid cooking fats. Omega-3 fats are recommended in the diet. They contain essential fatty acids. They are found in oily fish, fresh or canned, such as herring, kippers, mackerel, salmon, sardines, and pilchards. Try to have at least 2 portions per week. Protein is an essential part of a balanced diet. They contain essential amino acids. They are found in meat, fish, eggs, milk and dairy products, soya, and pulses. Meat, fish, and eggs contain no carbohydrate, so have no effect on your blood glucose levels. Dairy products, soya, and pulses contain some carbohydrate, which is usually low glycemic index. Protein foods can contain fats, so try to choose lean meats, skimmed or semi-skimmed milk and dairy products, and try to keep to the recommended portion size. Fiber is an essential part of a healthy diet. Fiber aids digestion and can help to control your blood glucose levels. Fiber is found in pulses, beans, oats, whole grain breads, and cereals. It is also found in fruit and vegetables. Try to have at least 5 portions of fruit and vegetables a day. To gain a healthy amount of fiber, eat at least 5 portions of fruit and or vegetables per day. Drink at least 2 liters of water per day. Foods eaten on Shabbos usually differ to foods eaten during the rest of the week, but are similar on each Shabbos. It is important to try and keep a balanced, low-fat diet on Shabbos, as this amounts to 14% of your year. If you have problems controlling your blood glucose levels on Shabbos, contact your diabetes specialist. During the Jewish year, there are several religious festivals, some of which involve fasting. For people with diabetes, fasting can be problematic. Fasting may cause dehydration or hypoglycemia. People who take insulin for their diabetes should speak to their doctor or rabbi about the shiurim rules for fasting. People treated with diet or tablets should speak to their diabetes specialist about any changes to their usual routine. Alcohol can be consumed as part of a healthy diet in moderate amounts. The recommended amount of alcohol per week is 14 units for women, 21 units for men. Always eat some slow-acting carbohydrates when drinking alcohol. Alcohol on an empty stomach can increase your chance of hypoglycemia or low blood glucose. If you use grape juice instead of wine, try to have a small glass only, as grape juice contains a high proportion of sugar. In summary, eat regular meals. Try to have 3 well-spaced meals per day. Choose long-acting, low to medium glycemic index carbohydrates. Eat at least 5 portions of fruit and or vegetables per day. Try to cut down on high-calorie and high-fat foods and snacks. Drink plenty of water. Use food labels to compare foods. Kosher foods are often imported, and their labeling may not be as clear as food packaged in Europe. To find out the contents of kosher foods, you may need to take a trip to the supermarket and compare labels on equivalent foods. When you were diagnosed with diabetes, you should have seen a dietitian. A dietitian is a health professional who specializes in dietary advice. For more specific advice for your lifestyle and circumstances, ask your GP for a referral to a dietitian who will be able to give you more detailed advice. Regular exercise is part of the treatment for diabetes. Regular exercise can reduce your blood glucose levels, improve your diabetes control, help maintain a healthy weight, help reduce your weight if you need to lose weight, reduces your risk of cardiovascular disease, lowers blood pressure, boosts your immune system, improves mood and reduces the risk of depression. There are many forms of exercise, and if you can incorporate them into your daily routine, you should be able to sustain the exercise. Some examples of everyday exercise are walking upstairs instead of using lifts. For short journeys, walk or cycle instead of driving. DIY and gardening, such as painting or raking leaves. Do the housework at double time. Going for a walk with a friend. Get off the bus 1 or 2 stops early and walk. The recommended amount of exercise for everyone is 30 minutes at least 5 times a week. This time does not have to be all at once. It can be in 2 15-minute sessions or 3 10-minute sessions. The exercise should make you feel a little out of breath and your face should be flushed. To gauge your fitness, invest in a pedometer. The recommended minimum number of steps per day is 10,000. This sounds like a lot, but try it. You may be surprised at how many you already do. If you don't reach this target, build up slowly and set small achievable targets, building more exercise into your daily routine. Many areas now have organized walking groups or exercise groups at various levels of ability to suit all people. From those who have never exercised before to those who want an advanced group. Groups are usually from half an hour up to 1 hour in duration. You can find out about walking and exercise groups from your local council. Your diabetes specialist should have information about local groups in your area. You could set up your own group with your friends and combine walking with socializing. Exercise should be enjoyable. Why not try a regular walk in the park? Seated exercise for those with mobility problems. Jogging or running. Gardening. Cycling, perhaps to work or to visit friends. Dancing. Swimming. Try a new activity and see if you enjoy it. Exercise is available on prescription. Ask your diabetes specialist for details or contact your local council to find out more.